recording button. Everyone should be receiving a notice that says this meeting is now being live streamed. So we want to welcome everybody to today's informational session. And with that, I will turn it over to our Executive Director, Miss Sika Rose Green.
Good afternoon, everyone. There is a plane going overhead, so I don't know if you can hear that, but thank you for joining us for this informational session on the invitation to negotiate for family resource centers that has been issued by the Children's Services Council of Leon County. So if you've read even the introduction to the ITN, you are aware that Children's Services Council of Leon County, otherwise known as CSC Leon, is interested in selecting one provider to help us establish 2 family resource centers in Leon County. We are so glad that you are on today to learn more about what your invitation to negotiate proposal should contain, and for us to answer any questions you may have. I will turn it back over to Holly at this time. We will be watching the chat in case you want to put questions in the chat. We will go ahead and answer those once the presentation is done. Additionally, you do have the opportunity to submit questions in case you're a little shy. You can do that at procurement@cscleon.org. And at a specified point, Holly will give us those deadlines. We will publish all of the questions and answers to our website under the ITN section. So thank you again for joining us, and I will turn it back over to Holly.
Thank you, Sika. Appreciate the introduction. As Ms. Green stated, we are looking for a single vendor to be our partner in Family Resource Center establishment and management. And so in line with our procurement process here at CSC Leon, an invitation to negotiate means that it's a 2-step evaluation process. Once all proposals have been received, we will have one team of evaluators that review the written application that in essence will create a short list of scorers to then pass to a negotiation committee who will then conduct oral interviews with the prospective vendors to kind of come up with a single recommendation. So the intent of today is to walk through specifically what we are looking for in that application process or in that proposal, that written proposal process, and then to, as Ms. Green indicated, entertain any specific questions that have been submitted in writing in the chat. We do just want to reiterate that all questions that must be submitted in writing. So please use that chat function as opposed to like raising your hand or trying to verbally share the screen with us. As a point of just clarity, for a point of clarity, I will ask that everybody remain on mute throughout the duration of today's recording. It will also be posted on our website along with our YouTube channel, so anyone can have access to this informational session regarding the invitation to negotiate. If you're unfamiliar with the Children's Services Council of Leon County and where to access the full information, you can go to our website, cscleon.org, and then there's a button on the front page that says funding opportunities that you can click on, and it'll take you to all of our open procurements. Similarly, you can hover over on our menu items and look for announcements or news, and then under that it will also have funding opportunities. Both buttons take you to the same place, and they are organized in chronological order of release date, and you just kind of toggle each one on and off. And the very top one that is published says Family Resource Center Management. Unlike some of our other open procurements, this does not have an application portal that we do for our community investment, our community investments that we have out there right now. We are, again, looking for a single vendor to be that partner for Family Resource Center Management. And when you go through the ITN, it will look different from our other procurements that are currently open. We have developed what we call a draft statement of work that goes into the details of what we anticipate would be expected for Family Resource Center management. And we're going to kind of walk through some of those expectations, as well as what are these nationally recognized standards that focus on collaborating with families to solve problems. That's ultimately our goal, is to create these neighborhood resource hubs that are focused on serving the whole family to really support resource acquisition that promote health and well-being. Family Resource Centers, for those who are less familiar with them, hopefully you're joining this because you're familiar and that you have experience in providing them. But for those of you who are just interested in learning more, Family Resource Centers are typically using a set of national standards that promote quality and have been largely correlated with the prevention of child maltreatment and the increase in family functioning. And that is certainly what we are seeking to do. We will share that we have allocated up to $4 million for a 26-month initial grant cycle. And as Ms. Green stated, that would be to set up a minimum of 2 Family Resource Centers that would be fully operational by a midpoint specified in the contract. We have an idea of what we think that will look like, but again, are inviting those proposals to negotiate the exact timelines for each of those pieces. Additionally, we'll say that the goal of the Family Resource Center for this funding is to really create the establishment of the centers and some very specified core services, but is not intended for the management partner that is selected to be the sole provider of all of those services. Leon County has a plethora of programs, some that are highly correlated with evidence and others that are emerging or promising practices, but have very well established relationships, and they're in the community that we hope to serve. And it is our expectation that the selected vendor will be leveraging all of those partnerships and for those core service provision as part of their application. So we are really looking forward to receiving a proposal that truly shows that collaborative approach to not only establishing and managing a center, but that there are some on-the-ground relationships or at least letters of support for that will establish those relationships as we move forward. Please note that any entity is eligible to submit a proposal. So this is not limited to just a nonprofit, a traditional 501c3, but that any entity. What we're really looking for, however, is that they have at least 5 years of experience providing similar services. So like truly those services that are materially similar to those specified in our statement of work. And that includes following those national standards. We are requiring that every applicant submit in writing 5 bound copies of their proposal that is mailed through, it can be through courier service or the U.S. Postal Service, that it must be received by a time certain. Again, this is not something to just email, and we do not have an application portal. We are requesting that they be couriered, hand-delivered, mails, whatever it might be, by the date certain that is included in the timeline. Just to reiterate, in terms of the process, this is a two-part process, an invitation to negotiate, meaning an applicant will submit their proposal. That initial proposal will be scored accordingly, and then it will be determined to set a certain threshold or kind of shortlisted, then move into negotiations. The negotiation committee will make a final recommendation, but I just want to clarify that the decision makers in this process are not any of the committee members or are not staff members, but rather is our full 10-member council. If you are not familiar with the Children's Services Council of Leon County and who serves as a council member or our process, we invite you to visit our website, cscleon.org, to learn a little bit more about our organization. Finally, the way that the procurement will be scored is outlined in the RFA, or excuse me, the ITN, in terms of the different sections We are asking that you kind of include that cover letter, an organizational profile, a very detailed program design, evidence of effectiveness, which we'll talk about in just a few moments, and your proposed pricing and kind of that outline or timeline for implementation. It will be evaluated on kind of 4 sections. The first is your organizational profile, which really outlines your experience in this space. That is worth up to 15 points. Then diving into your program design, or kind of like that's more like your proposal narrative, where you're really going to outline what you're going to do, how you're going to do it, and kind of like what impact that some of that will have in terms of how it's related to the goals of the procurement. That is the meat and potatoes of your proposal, and is valued at up to 40 points for the scoring process. And then we'll ask you to highlight that program evidence. So again, we're going to dive into this a little bit deeper, but that program evidence is really wanting you to demonstrate how your program services and activities will truly result in the desired outcomes that we're seeking. That section is worth up to 20 points. And then the final section is your budget. Ultimately, we want to know that the investments that we are making are cost effective, and having a super detailed budget that includes a corresponding narrative on how how you propose to use the funds is important to us. It's also important to note, however, that it's not a cost reimbursement model, but rather a fee for service or a deliverable model. So while you have an outlined budget where we want to kind of see how you propose to use the funds to ensure kind of that cost effectiveness, ultimately the structure of the contract will be deliverable based and kind of allocated based on successful successful submission, review, and acceptance of various reports that again we'll go into in just a few moments. So I'm going to start with kind of talking through what the statement of work includes. This is found as Exhibit 1 to the ITN and really provides a very detailed background and rationale for what family resource centers are and why the Children's Services Council of Leon County is looking to use this model to address some of the systemic issues that we're experiencing here in Leon County. On page 2, you'll find a listing of 9 criteria or principles or best practices related to family support. And these should be woven into your approach in your program design. Immediately below that, we start to dive into our program design. And we talk a lot about history and location, and we want you to kind of really design things. I want you to kind of pay very close attention to both of these sections, for what we're really looking for is evidence of those 9 best practices woven into the narrative for these elements that are listed under program design. We want you to kind of like systematically describe in your program design each of these elements, identifying A through, I think it goes all the way up to L, that you'll be required to kind of show for. Thinking through, I'm going to dive into just the location piece of it to start, is that we actually want you to propose locations to be considered. Ideally, you will provide up to 4 feasible locations for the family resource centers, knowing, however, that you will only be required in this initial contract to situate or kind of set up shop, if you will, at 2 of those. We definitely want to see evidence that you've reached out, that you've kind of sourced those neighborhoods, and that you have letters of support from nearby organization or businesses included in your project design. We are also really looking for kind of what that expected timeline will be. So we're thinking that the 2 locations will be operational by no later than February of 2025. That's both of them, but we want to see kind of that timeline. Your proposal might be that you're concurrently establishing SHOP and setting them both up at the same time, or that you set one up and get that operational and then set up another one. Ultimately, that is up to the vendor's discretion in terms of how you include that in the proposal. Our expectation, however, is that both will be operational no later than February of 2025. We do want to say that there is an opportunity for subsequent renewals to include funding for additional sites, assuming that you kind of have successfully implemented the first 2. And so know that as you're going through the process, and when we get to reporting in a little while, my colleague will describe what that initial eligibility, or excuse me, the renewal eligibility assessment looks like. The next kind of biggest piece under that program design really is the 6 points of programming. We know that there's lots of family resource centers out there that do a lot of things, but we also know that this is brand new for our community in terms of the level that we are seeking and the exclusivity for families. So these are the 6 core pieces that you will find on page 13 of the ITN that really dives deep into what we're expecting a well thought out proposal to include. So that includes parent education, child development activities, resource and referral, drop-in availability, peer-to-peer supports, and life skills advocacy. They're each defined within the ITN, but also there's a lot of resources that are available through the National Networks for Family Resource Centers that you can find additional information about there. That you will, if there are ancillary services that you want to provide initially, you can definitely include those so long as these core services are covered. In addition, it is expected in terms of the partner that we find that as we approach renewal eligibility, that we would expand service provision. Again, we didn't want to say right from the get-go that you would need to do all of these core services and all of these ancillary services, but rather that we have a measured and stepped approach to service provision. There are additional components in there, including establishing an advisory council per family resource center. So not for all of the family resource centers, but per family resource center. The idea behind that is evidence shows that individuals who live within a neighborhood that are actively engaged in the neighborhood and service provision happening in their neighborhood are the best representatives for that neighborhood. So that's what we're seeking in that advisory council. Again, for those of you that are familiar with these types of programs, this should not be new, but for those of you who might be still kind of like, oh, we do all of these, but maybe not this element, there are lots of resources available to you from our national partners. This last kind of, or this next section about target population, we do want you to include how many unduplicated families will be served by the individual neighborhood family resource centers per year as what we define as either drop-in or member. And we put those in quotation marks because we understand that some family resource center models don't use that terminology of what does it mean to be counted as a drop-in versus what does it mean to be a member. And so we just want to clarify that we know that family resource centers will serve more than just members because it is kind of that drop-in facility and it is that neighborhood hub, but that we, for those that are serving members, those are those that are a little bit more invested in the services. They've come in, they've maybe filled out a profile, they've done an assessment. You're providing regular services through the Family Resource Center for that. You may call that something different, and that is okay. We do ask that you clarify in your target population description that for you, drop-in means X, member means Y, so that we can start using the same terminology. Again, that this is why we are doing an invitation to negotiate, because our successful vendor should have that experience and will be using your language that is proposed or finding that mutual language that meets both of our needs. If you are an entity that is not located in Leon County currently, that is fine. You might be a national organization in another state or in another community. These targeted zip codes that you'll find in our application, 32301, 32303, 32304, 32305, and 32310. Are those those neighborhoods that have a concentration of poverty. We will make available to you on our website our 2022 asset and needs assessment that really highlights those kind of neighborhoods and what are some of the issues that are in those neighborhoods. And that is why we chose to incorporate or target these services there. When you make your proposal of potential locations, they must be located in these zip codes. We understand that you can provide transportation or like bus passes for people to kind of access services, but that is not our intent. Our intent is that they are located in these zip codes. So please just kind of keep that in the back of your mind of why you're choosing the site. Is it located in that zip code? And if we could, we would probably even go down to that census tract level of really trying to overcome some of those transportation barriers for what we're seeking. We include kind of sample recruitment targets that you'll kind of just see the way that we've defined them. Again, you can define them the way that you would like to define them. A couple of last kind of things for program design before I open it up to my colleagues is this concept of participation fees. Our goal is that membership should be offered to families free of charge, or at the very least, a very, very, very low cost. We know that some models for family resource centers do associate like a sign-up fee or a cost to kind of create that initial buy-in. And then other models have monthly fees, whatever. Our goal is that price and cost would not be a barrier at all. If your model that you are proposing for your family resource center includes any type of fee for any type of service, we want to know that upfront. So even if it is, say, for example, you have drop-in services, or you are proposing that your core services include some sort of respite care, or like, a parent's night out, or whatever it might be, and that you're going to charge fees, that you outline those in advance so that we truly understand what the expectations are, and that this is understood as a point of negotiation, that if there is a way for us to not charge that might be a request from the CSC, but just to have that information together. And finally, in your proposal, we want to ensure that you have in your staffing plan a well thought out staffing plan that includes individuals that will be able to assist in the recruitment and retention of members, to do the necessary marketing, to do the necessary data collection, to do the necessary reporting. Now, we do use something that is called SAMIS. It is our Services and Activities Management Information System that you will be required to collect data on your members and some basic information on any drop-in clients. But ultimately, all of your reporting of outreach, resource and referral, those core services provision will be required to be documented in our data system. So we want to ensure that all proposals, especially in their staffing plan, consider that. And that's actually a really good time to introduce my colleague, Miss Stephanie Eller-Vaughn, to talk a little bit when we say, okay, well, what is this data collection that we're going to be requiring for your application, and so that you are fully aware of kind of that level that we're looking for. With that, I'll invite Stephanie to come up to the Zoom stage.
Hi there. Okay, I appreciate the introduction. My name is Stephanie Eller Vaughn, and my role here at the CSC is Program Accountability and Research Manager. And one of the things that we are charged with is to demonstrate that our investments provide a measurable return on investment. And if you've taken the time to read through the RFP, you'll notice that data collection and reporting requirements are quite specific. And my role today is to help you understand these requirements if you happen to be selected for this ITN. First, I'm going to touch on a few things that, and this is sort of out of order from the ITN, is evidence of effectiveness. So it's our intent to fund programs that have empirical evidence demonstrating their effectiveness. And level of research evidence exists upon a continuum, which starts with the highest level of standards of program design and reproducibility and effectiveness for our targeted outcomes. And Family Resource Centers falls into a research-supported category known as promising practices, which are programs that are based on sound theory. They've been rigorously evaluated in other communities, and they demonstrate some level of effectiveness. Now, for one of the requirements that we specify in the ITN is that we want you to show us a logic model. Under program design, we reference both the theory of change and a program's logic model. And if your organization has a theory of change, this will support your application, but we are not requiring that. And very briefly, a theory of change is a fundamental component of any large-scale social change effort and serves as the basis for meaningful measurement. And we at the CSC have a very comprehensive theory of change, which you can access via our website if you care to look at that. But a logic model is a type of theory of change that is most often used when actions involve direct services or a discrete intervention for a specific group of people that is implemented in a very prescribed manner. It articulates all of the elements of the program, from resources to activities to outcomes, both long-term, intermediate, and short-term, intermediate, and long-term outcomes. And if Holly would mind, if you could put that, if you have it ready. If you don't, that's fine. Okay.
Because I pulled the wrong slide. I apologize. I'll do.
I'll give just a brief overview. It's a pictorial. It's sort of a pictogram that sort of demonstrates how you move from inputs to the various aspects of your program that leads to the final outcomes. There's a logic between the way the parts fit together. So, this type of model, and if you Google logic model, you can find thousands of them. So there's some that are quite simple. There are some that are extremely complex, but we are providing a training session on that through our partner, the Institute for Nonprofit Innovation and Excellence. And they're going to be hosting this training session on April 13th at 1 p.m. via Zoom. And we will be dropping that link into the chat so that you can access that and register for it. So the next component, and I'm really just going to talk very briefly about this because we're also going to offer training on something called results-based accountability, or RBA. And this is the framework that CSC Leon will be using to measure programmatic impact for all of our programs. And RBA essentially teaches providers how to start with the desired outcomes and work backwards to determine what actionable items do you have to achieve the change you desire. It's the opposite of a logic model. So with one, you sort of start with the inputs and work forward. With RBA, you start with the outcomes. And I really, I'd encourage you to look at the outcomes that we have prescribed in the ITN, because these will be very important to your success in the long term. RBA comprises 2 levels of outcomes: population accountability and performance accountability. We're not going to hold you to a population level accountability. So that's the RBA model. Let me, but to step back, population accountability, it refers to a geographic region, such as all people in the US, or all seniors in Florida, all children in Leon County. So it's quite broad. It's bigger than what any one program can be expected to impact. So it's only through collaborative partnerships and shared goals and common metrics that we can expect to make a collective impact, which is the key term there. And that's how a community moves the needle. Now, on the other hand, performance accountability is about our role as managers and how we run the programs for which we are responsible. This operates at all levels of an organization, from the smallest program up to the performance of an agency as a whole. Now, RBA asks 3 central questions: how much did we do? How well did we do it? And is anyone better off? And while each question isn't very important, they're not equally important. And so if Holly would mind, if she has a second, if she could put that graphic back up and I can sort of go over it very quickly.
I can attempt, Stephanie, but I just did it before and it kicked me out. So please know that we will post that as an addendum or as a resource on our website. But I will try.
Okay, well, I'll just keep going, and you can reference the graphic later. It's quite simplistic. It talks about the quantity of what we do and then the quality of what we do. So the least important question would be, how much did we do? And, that would be the total number of kids served or the total number of families served. The second in the upper right-hand quadrant, we're talking about quality. How well did we do it? And one metric might be, say, the number of instructors with the appropriate credentials and training, like a licensed clinical social worker. And then number 3, as you can see along the bottom there, is anyone better off? That's the most important question that we're asking. And we would measure this. You can measure this either as a total number of people, such as the total number of people who complete a program, or the percentage of enrollees who are successfully, let's say, diverted from protective services involvement through a program like the Family Resource Center. And so we will be specifying what those RBA outcomes should be. But in addition to that, we will be conducting mandatory site visits, and that together will inform the evaluation of your program's effectiveness. And again, we will be providing further training on RBA for the provider who is selected to receive this funding. Now I'm going to move on to data collection. And with regard to the data collection requirements for the Family Resource Centers, you need to demonstrate a capacity to adhere to the data collection requirements and the performance indicators listed in the ITN. And one way to do that might be to submit a data collection timeline and a description of the activities that you plan to do in order to collect this data. Say, for example, if you plan to administer the prescribed surveys using paper and pencil and have the staff manually enter this data into our system, you need to specify that. Or if you want to administer the surveys digitally and upload the data, that again is another way you can demonstrate your ability to collect this information for us. So on to the actual requirements. So number 1, under data collection requirements, we are asking the selected entity to collect basic demographic information. That way we can verify that we're reaching our target population. Number 2 is we want to know the number of families enrolled as members, and then the number of folks who are considered drop-in participants. This would also include the number and types of activities and or referrals given to both members and drop-in participants. The third item is quite important, and that will be the administration of 2 family functioning assessments with members to measure gains in both the protective factors, which Holly touched on, and family functioning. And these have to be administered based on prescribed timelines using a survey, a validated instrument that we will be providing to you. And any training that is necessary will also be provided by us. The fourth item is a brief member satisfaction survey. We'll be providing that. It's requesting feedback on the overall experience of the family, level of satisfaction with program staff, whether the family, and most importantly, whether the family would recommend the program to other parents. And the fifth item is a community partnership satisfaction survey. As Holly referenced, we do expect you to work collaboratively with some of our partners here in the community. And so we would ask you to administer the short satisfaction survey periodically to identify both program strengths and areas of improvement. So these surveys can be administered in a variety of ways, but all data has to be input into our system, the SAMA system. SurveyMonkey and Google Forms are inexpensive tools. Should you choose to go that route, they're easy to distribute. They calculate responses automatically. You can use traditional pen and paper, depending on your population. However you choose to administer the surveys, you have to budget, or I would strongly recommend that you budget staff time and tool expense accordingly. And we also ask you to consider the fact that manually inputting data can be very time consuming and tedious, and a little research on the front end could potentially save you a lot of time and effort on the back end. So performance indicators, I'm not going to read these because actually when you input your data, SAMHSA is going to automatically calculate this for you, but it will be monitored on a rolling basis, both on site and through just observation of the SAMHSA data. And I will point out, it's important to note that in order for programs to qualify for a contract renewal, the stated targets should be met. That being said, we understand this is the first year, it's a startup year. We're here to help you become successful as we collectively build the family resource centers. So Holly, shall we now jump into reporting requirements? Would that be? Okay, so now we'll move into the final segment of the presentation, which is reporting requirements. And I will introduce our Director of Finance and Operations, Dina Snyder, and she will discuss the remaining requirements with you.
Good afternoon, everyone. Once again, and thank you so much, Stephanie, for the introduction. My name, like she said, is Dina Snyder, and I'm the Director of Finance and Operations. I will now briefly review the reporting expectations and the funding disbursements for the FRC management ITN. As Holly mentioned earlier, contract recipients will provide regular reports through SAMHSA. These reports will be due at specific dates throughout the span of the initial contract and include the following. We will have an implementation status report. The report will include at minimum a brief narrative on the status of location acquisition, staffing, community partnerships, services, and memberships. The initial report is due by October 7th of 2023, and thereafter they will be due quarterly, the 7th of the months of January, April, July, and October of 2024, and January and April of 2025. A data and budget report is also due. These reports include at minimum a brief narrative, status report on data collection efforts, an overview of expenditures from the reporting period. This report, the initial one, is also due on October 7th of 2023 and quarterly thereafter the 7th of the months of January, April, July, and October of 2024 and January, April, and July of 2025. A monthly membership and activities report is due on the 7th of every month starting on March of 2024. The report will include demographic data of the children, youth, and families served by the FRC, the number of meetings, number of events, and types of supports provided to the families, and so forth. A renewal eligibility assessment report must be submitted no later than July 7th of 2025. This assessment will include a program narrative, preliminary outcome findings, a SWOT, strengths, weaknesses, opportunities, and threats analysis of the program, expansion plans, compliance with enhanced data collection, and reporting requirements based on external evaluation findings. And budget requests for the continued funding beyond September 30th of 2025 will also be included with this assessment. Lastly, the final report is required by no later than October 15th of 2025. The report will include at minimum a complete program narrative, final distribution records, and a detailed expenditure report. As a reminder, any unspent funds are required to be returned to CSC Leon by no later than September 30th of 2025 to avoid fines or exclusions from future funding opportunities. The funds may be returned via mail postmarked by September 30th, and they can be mailed to our office at 2002 Old St. Augustine Road, Suite A-50, Tallahassee, Florida, 32301. With regards to funding disbursement, CSC Leon has allocated up to $4 million for the initial contract from August 1st of 2023 to September 30th of 2025 for the FRC management ITN. During the negotiation phase of the ITN procurement process, a funding disbursement schedule will be negotiated based on established contract deliverables. As a quick reminder to you all, you can access the CSC Leon fiscal guidelines on our website. While the funding disbursement for the FRC management ITN will not be established as it plays out in the fiscal guidelines, it will be established during the negotiation phase. However, the fiscal guidelines provide detailed outline on program budgets and required reporting documentation. I will now turn it back to Holly so she can review with us the timeline and we can process over to facilitating the Q&A.
Thank you, Dina. I just want to reiterate kind of like what Dina said in terms of the expectations for those reporting is what we have laid out in our statement of work, and that if through the negotiation process we come up with a different timeline or additional requirements based on your application, that could occur. That statement of work that you see is a draft and will be well hammered out through the negotiation phase. Including some of those expectations for deliverable-based funding. And so I really just want to point to that. It's not really written into the ITN of that important piece that she discussed of what is the timeline for disbursements related to this procurement? What will that look like? And so that will all be ironed out in that negotiation process. We really want you to include that in your proposal of expectations. I will also just in terms of timeline, we are requesting that all proposals are returned to us or submitted to us no later than Friday, May 5th at 2 p.m. We will do a public opening of all responses so that you know, so that everyone kind of knows and has an expectation of how many potential vendors are in the mix. That will be held here at our public offices on Old St. Augustine Road in Tallahassee, but we'll also live stream that and anyone can participate in that kind of public opening. I skipped that and saying like that's our due date. We also have the opportunity to ask any clarifying questions. Those questions should be submitted via email or in writing either at today's webinar in our chat function or via email to procurement@cscleon.org. That email address is included in the ITN, and those are due by 5 p.m. on Friday, April 14th. All answers to those questions will be posted in that same procurement space on our website on no later than Tuesday, April 18th. It will also include any additional addendums that have been generated by questions posed. So just know that, kind of flag that on your calendars. So the morning of the 19th or the evening of the 18th, kind of going in and seeing what questions got asked, what the answers are, and if there's additional materials to help cultivate your response. It is our intent to have kind of our first round of evaluations completed very quickly. We're looking at Friday, May 12th, just to kind of turn those around to really evaluate that short list by those scoring criteria. The scoring criteria is not the only deciding factor in the selection of our vendor. After we have kind of that first round of evaluations completed, we will host a public meeting to discuss those outcomes and convene a strategy session on who we want to bring back. So you'll see that in the calendar as callbacks on Tuesday and Wednesday in the latter part of May. Those will be an opportunity for very specific questions and kind of commencing that negotiation period. We will allow for any vendor who goes through that process to submit a best and final by the end of May. It will be that best and final that is then ultimately evaluated to determine which particular vendor we want to move forward with. Our negotiation committee will kind of host that public meeting in terms of where they're leaning, where they're deciding, and formulate in writing a recommendation for who to select. That recommendation will be presented to the council on Thursday, June 15th, with the expectation that an intent to award would be issued by the council should they take that recommendation. It could also be that they provide the directive to not accept the recommendation and to kind of go back to the drawing board, and we'll know that on June 15th. If everything goes accordingly and the intent to award is issued, we do hope to then really commence with that contract negotiation based on your best and final that is submitted. And then to bring back to the council that kind of final contract for signature and approval in July with that anticipated contract start date of August 1st. Based on what has been allocated and encumbered for the purposes of this contract, we will be doing that eligibility assessment at least a full quarter in advance of when the funding would end, should the applicant be successful, and to know kind of what the next phase and expectations are. The last thing I'll say before turning it over to the team to facilitate question and answers is that we're not just hiring someone to do a job. We really do want to be partners for successful implementation and to achieve the community impact that we're trying to achieve. All of the tools that we're developing, all of the trainings that we develop, we want to do in partnership with the selected vendor and not in isolation. So I say that because there's a lot of requirements and expectations for this, but ultimately we are looking for a long-term partner to manage these centers that will be centers that are managed and operated independently of CSC, but we want to be heavily involved in making sure that they're reaching the intended impact, reaching the intended communities for the hopeful impact that we're trying to achieve. So with that, I have not seen any questions come up in the chat, but we do want to reserve the last 10 minutes of this, that if you do have questions, you can feel free to post them now in the chat. We will read them off for the purposes of the recording and do our best to answer them. Or again, you can submit questions related to this process directly to our team at procurement@cscleon.org, no later than Friday, April 14th. I want to be cognizant that if you don't have any questions for us now and you want to sign up, that we accept that. Our team will hang on for a few moments if there's any stragglers that are still typing. All right, I don't see anything popping up, so this will conclude today's informational session. A recording will be published on our website as well as accessible at any point from our YouTube channel. Thank you, everyone.